AFCBT stands for Alternatives for Families, a cognitive behavioral therapy. AFCBT is an evidence-based, trauma-informed family treatment designed to improve relationships between children and their caregivers. It was developed to help families who struggle with anger, conflict, and physical force or aggression. In some of these families, caregivers have been concerned about their use of harsh or ineffective discipline, or there has been a history of physical abuse. AFCBT has also been applied to help families in which children have shown challenging or problematic behaviors and/or experience traumatic reactions. AFCBT can help families learn how to use positive coping and self-control, effective and safe discipline strategies, and family problem-solving and communication skills. These skills can improve child and caregiver well-being, help families get along better, and maintain a safe home environment. What are some of the common consequences of being exposed to conflict and physical force? Research studies have documented several consequences, including strained caregiver-child relationships, symptoms of traumatic stress, legal problems, the removal of a child or caregiver from the home, and significant types of emotional and physical injury. Some children may have trouble with peers in school and in the community, which may lead to caregiver frustration and the use of inconsistent or unsafe parenting practices. Who is appropriate for AFCBT? A child or teen who is between the ages of 5 and 17 and at least one participating caregiver are appropriate for participation in AFCBT if they experience any of the following problems. A caregiver and child who have frequent conflict and arguments. Family members may get very angry at one another. This may lead them to say mean or critical things, to humiliate each other, to put each other down, or to curse. A child may exhibit problem behaviors that have become difficult to manage, such as arguing, being defiant, not following rules, fighting, or engaging in other troublesome behaviors. Sometimes, these children experience symptoms of post-traumatic stress. A caregiver may use physical discipline or force when other forms of discipline do not seem to be working well. This may lead to the use of harsh discipline or more extreme forms of punishment. And lastly, physical force or discipline can lead to an incident of physical abuse where a caregiver has done something that has hurt or injured a child. So, if you have any of these concerns about a family, that family would probably be appropriate for AFCBT. It is important to carefully consider whether a given family is appropriate for AFCBT. A family may be appropriate for AFCBT even if it shares any of these unique backgrounds. AFCBT focuses on the strengths and difficulties within each family using methods that are tailored to each child, caregiver, and family. We focus on teaching skills that can serve as alternatives to the use of more risky or dangerous behaviors. Some of the goals of AFCBT include supporting families under stress or exposed to conflict or trauma, teaching coping skills to help them manage their emotions and thinking, teaching positive parenting strategies, strengthening family relationships, enhancing child and family safety, and supporting any goal to prepare the child and caregiver for reunification. How do families benefit from AFCBT? Research on AFCBT has shown that families report several improvements after services. For example, children have shown gains in their use of social skills and fewer symptoms of post-traumatic stress, have reported more appropriate parenting practices, and felt more safe and secure at home. Caregivers have reported using fewer negative parenting practices and more nurturing practices, and less physical aggression by their children. And families have reported less conflict and more cohesion at home. Some evidence shows a greater reduction in official reports of physical abuse or harm to a child. There is additional support showing that these families are more likely to reach their individualized service goals. The children show few behavioral or emotional problems. The caregivers report less stress related to child rearing and are more satisfied with their services. By teaching several adaptive skills and improving child, caregiver, and family functioning, families may experience several benefits after AFCBT, including improved child behavior and well-being, caregiver self-control and parenting skills, and family functioning. One unique feature of AFCBT is that it allows families to receive several different types of treatment services delivered in one program and by one provider in one location. This avoids having to send the family to different providers who deliver each of these services in separate locations. For example, AFCBT includes training in parenting skills, anger management, trauma treatment, family therapy, and individual therapy, all in one program. This allows the family to receive one-stop shopping, which places far less burden on the family. It can be challenging to care for a child who struggles with defiance, aggression, or other problem behaviors. Family conflict can easily lead to caregiver frustration and the use of harsh but ineffective discipline. That's why AFCBT includes specialized content and skills that are delivered in 3 phases. These phases allow the provider to engage and understand each unique family and provide some background education about the ways in which they interact, to teach important skills to the caregiver and child in individual sessions, and then to work with the caregiver and child together to help them learn and practice new ways for them to communicate and solve problems. What skills do families learn? Well, they learn how to maintain a safe and stable environment. They also learn skills to calm and safely manage children when they're out of control. They learn strategies to manage their frustration and anger, maintain positive, flexible, and helpful thinking to maintain self-control. Once learned, caregivers and children are better equipped to gain composure and remain calmer. AFCBT teaches both caregivers and children specific interpersonal skills, like how to use routine parenting practices to both support positive behavior and discourage challenging behavior in an effective and safe way. Children learn key social skills that they can use to appropriately make requests and handle criticism. These skills can also help them to better communicate with others, especially family members. The family also learns methods for solving problems together and as a unit, communication skills that will help the caregivers and children both express what they want. And we teach the family to use effective strategies to solve family problems without anger or aggression. Providers can tailor the content of this program to their clients' unique needs. AFCBT involves individual child, individual caregiver, and parent-child or family sessions. Any adult caregiver with at least one child is eligible for AFCBT. So far, AFCBT materials have been translated into Spanish, Japanese, and Korean. Programs that offer AFCBT may see families in different settings, such as clinic, school, your home, or another community setting, and they can schedule visits at times convenient for their clients. Scheduling a family can be very flexible. Some families may want to be seen once per week, but others may be seen once every 2 weeks, possibly for a longer time each visit. Most families receive AFCBT for at least 6 months, but the actual amount of time depends upon your attendance and participation. When families commit to AFCBT, they can benefit and finish in less time. To learn more about AFCBT, we encourage you to go to www.afcbt.org. AFCBT.org has information about the model, its support, and its resources. There's information for families, administrators, providers, and stakeholders. You can even find an AFCBT service provider anywhere in the world by going to www.afcbt.org.